This male is 47 years old. The reason we have this male here is, again, we have a chronic case of gastrointestinal candida overgrowth, more or less over 10 years. And again, one of the triggers for this patient was stress. And the gastric symptomology would fluctuate severely with the level of stress that this person is experiencing. Now, this person's only experienced IBS type symptoms, and we're going to talk about IBS further along because IBS is actually also attributed to candida overgrowth. Some stomach distension, indigestion, generally had some fatigue, muscle aches, and severe sugar cravings that were generally triggered by anxiety and stress. As a result of those sugar cravings and that stress, this person broke out in hives, so they had immune compromisation and also some nervous system involvement as well. What we recorded post-treatment for this patient was that his improvements showed up more in the second and third weeks of treatment, and particularly that gut distension was severely reduced. Now, this patient was quite interesting because if they ate something that would trigger or feed that candida infection, their distension was quite severe to the point where the abdominal skin actually became quite shiny and quite tense and very, very heavy. He found that the gut symptomology calmed down quite a bit. He had decreased levels of fatigue and stress. He was going through some stressful circumstances during this 4-week period as well, but he found that his response to stress wasn't as severe, so it didn't trigger things like the hives or the sugar cravings. He found that he had some improvement, but because he believes that he is more of a chronic case, he chose to continue using the Horopito treatment post the study, just so he can maximize the benefits of that treatment. And again, no side effects for this patient.